non-invasive approach to pelvic floor dysfunction for men, when I was first presented with that question, I asked, well, what does invasive mean? Because in my world, invasive means surgery or some kind of a procedure. In reality, when I started looking into it, I realized invasive to men means someone goes through the rectum to try to figure out what's going on the inside here. I guess welcome to the world of women and gynecological exams. We're so used to that. But jokes aside, I always ask, what is it that I'm trying to accomplish by going through the anus to the inside of the pelvis? Shouldn't the question be, well, why is the area that I'm working on being tight? Why is, let's just say, the prostate is enlarged? In reality, when it comes to prostate health, there are two things that assist it in being a decent size, meaning a normal, healthy size. One is activities like walking. The other one is intercourse. Intercourse is not masturbation, FYI. So there's too much masturbation, not enough intercourse, and we're taking the pelvis out of its natural environment. And then we're doing stuff to the pelvis, when in reality, we should look at the pelvis as a house that has a floor and the walls, just like a house does, and it contains body parts. So if the inside or the floor of the house is not ideal, we shouldn't just go and try to make it relax. What we should, in my opinion, what we should do is to find out why it is tight, why it is weak. The position and stability of the pelvis is the reason why the floor is compromised. When the floor is compromised, and bear in mind, the inside of your pelvis is all muscles, not just the wall. This is the wall. These are all the muscles. And there are muscles on the outside, like your lateral rotator, where the part of your glute area that rotates your legs outward, that supposedly we can access from inside. I say supposedly because no one has. I guess it depends on the size of the finger and the size of the pelvis. If it's a baby, maybe. But then again, we don't do this on babies. So we're looking at pelvic stability, and when the muscles on the floor and the walls on the inside are tight, of course the structures that are laying inside of this are going to be compromised. Their function is going to be compromised. So then the question is, why is it unstable in men? Because for the longest time, they have blamed pregnancy and childbirth and women as a reason why people have pelvic floor issues. Well, last time I checked, no man gave birth or got pregnant. So what's up now? The reality is our lifestyle is horrible. And if you're thinking you're active, well, then I start questioning the nature of your workouts. Because most often, from my perspective, I see men using the lower part of their glute closer to the perineal area as one of the ways they try to do different workouts. That is wrong. When you're sitting on your butt on a chair and you masturbate, that takes away the pelvic thrust, which allows more of the muscles on the inside and outside working in harmony to provide that thrust. We're doing everything the wrong way, and we are thinking going through the anus with the finger to access those areas is going to provide a long-term solution. It just doesn't make sense to me. So in my practice, when someone comes I'm looking for other things, other presentations that most often get missed. So we're talking about chronic malfunction or issues with the lumbar spine, with the pelvis itself, with the pubic area, with the legs, lower extremities. We're talking about the hips, knees, feet, and ankles. I'm looking at the posture. What is leading to this instability in the pelvis? What is your lifestyle like? Are you sitting on a chair all day? You tell me, why would this be stable when you're compressing it the whole time? So please understand what you're doing at any given day that is putting you in the wrong neighborhood of health. The digital examination and assessment in certain conditions, I understand, but that does not provide stability here, because most often when things are actually relaxed, the methodology behind movement has been altered based on the dysfunctions that you've been having all along. So if your methodology is wrong still, even if things are relaxed, they will be pulled into the wrong way of usage. So you're back to square one. In my opinion, pelvic floor dysfunction, it requires stability of the pelvis first. You don't think about the floor of a house when your house walls are not stable. Because even if you lay the most beautiful floor, when the house walls are unstable, you lose that functionality here, because it's going to crack and twist and whatever, settle differently. So let's use our common sense for things that we consider to be big issues. And when it comes to men, when it involves their penises and testicles and scrotum, they're like emergency 911. When in reality, you've been having a lot more serious issues that you ignored all this time. So just wanted to do a video on that. I hope you have subscribed to the channel. My whole purpose of doing these videos is to bring some common sense into the issue with the hopes that you will make better decisions. I hope you're following us on social media, and if you have any questions or if you'd like to make an appointment, make sure you use one of the methods of contact in the description box, and take care of that. Thanks for watching.